Okay, welcome. We are so thrilled to have so many of you join us today and in the interest in this truly historic investment that Connecticut has made in our children and our families and early educators. I'm most looking forward to being in conversation with our panelists today. We have a lot to talk about. This is a big topic. I know we won't fit it all in, but I first have a quick job of doing a bit of housekeeping and laying out a little bit about the legislation so that we have that as a foundation. For housekeeping, we just ask that everyone, if you have, keep on mute because there are many folks joining. If you do have any questions, feel free to put them in the chat. We are monitoring that, and we do have some time for Q&A at the end. We also have bios in the chats and some other resources that we'll be referencing. We won't be doing any long introductions today so that we can really focus on the core of the conversation. For those of you who aren't familiar with social impact partners, and I see a lot of familiar names, so I think most of you are, but we are a nonprofit organization that works throughout Connecticut. We are an intermediary organization with a focus on education and on workforce. We work really through deep collaboration and partnership. We leverage skilled volunteer partners along with our staff and really are seeking to build capacity, to build strategies, and really focus and help move forward high impact potential initiatives in the areas of early education, post-secondary education, and workforce development. So for those of you who are new to Social Impact Partners, thank you so much for joining us today. We have three goals. First, our goal is to celebrate. We really want to mark this moment. It is a historic moment, and we really appreciate that. The second thing that we're looking to do is be pragmatic about it. Though we are looking to celebrate, we're looking forward at how much more needs to be done in order to truly meet the vision of this legislation. And finally, we are looking to connect some dots for many of you who are Social Impact Partners volunteers. I have a picture here, some pictures here of some of the initiatives that many of you have leaned into over the years, the Blue Ribbon Panel, work with childcare for Connecticut support. I have a picture, two of the panelists are here at a kind of joyful rally, or this moment was particularly joyful from Hartford this year, and work directly with programs and with providers. So we really want to thank you for that time you've given, connect the dots to this moment, and lay out what we see is coming next for opportunities. And finally, just one last slide, and then we'll get right into the conversation. We want to talk about the vision that this legislation lays out. It's very comprehensive. On the left-hand side, I'm sure none of this is new to folks in early education, but it's important to touch on, where we are currently. There is a lack of access all across Connecticut, our urban, suburban, rural areas to high quality early education. And the cost is very high. For families, especially if infant and toddler care costs more than your mortgage, you're not going to be able to afford that. And for the majority of families in Connecticut, early childcare is unavoidable in early education. We also see very low wages. And what that means is a high turnover rate, closed classrooms, and when that happens, it really continues to crunch the accessibility and grow that issue. And further, after decades of underinvestment, we know that there's significant needs in the facilities for early childhood. So the vision that this legislation lays out, it is about a system and building that system over the next several years. First, it starts with funding stream. It created the Early Childhood Endowment Fund, which is a fund where unappropriated budget surplus can be utilized in this fiscal year going into next year up to $300 million. It's envisioned to grow up to $1 billion and beyond in the coming years and to really provide a long-term sustainable funding stream, whereas a portion of that can go toward the items to really address the system's needs. And that is expansion of spaces. So free or affordable for families with incomes less than $100,000, free early care and education, infant, toddler, and pre-K, and affordable for families over 100,000 in income. It is a maximum it lays out for these spaces of 7%, which is what is considered affordable. And then it doesn't do that at the expense of our early educators. So what's key here is the increased rates for meaning that that would be increased wages and access to healthcare benefits so that we would see a lower churn rate. We can really retain these early educators, which is so critical at this time of brain development for young children. And finally, there's bond funding for facilities. That was part of this package. And all together, what this makes is building of a system that is intended to meet the promise of this effective economic policy with a high return on investment. So with all of that said, I know that's a lot. We have some resources in here from the Office of Early Childhood, one of their presentations that really goes into even more detail on this. We're trying to keep it high level. There's a lot to share. That is it for our slides today, which I know is probably a relief to everyone. And we will welcome our first conversation with Senator Maher. Ceci, thank you so much for being here today.
Thank you for having me. I'm excited to talk about it because I love this legislation.
Well, that's the perfect introduction. And I know that you've been a leader, worn many different hats. Over the years, you have a background in nonprofit, community volunteering. So let's start with your why, which is why do you feel this effort is meaningful for Connecticut children and families, and why was it an important priority for you?
Well, I'm very aware, as everyone is who has any connection to childcare, how incredibly expensive it is. I was speaking to a young person the other day. They have one child. It's costing them $30,000 a year to have their child in childcare. And that is just not sustainable at all. And childcare is a workforce issue. So we're looking at the fact that people can't go back to work if they don't have childcare, which means we don't have enough people to fill the jobs that are open. But when you come down to it at its core, because I am a social worker and because I am a grandmother now, really the thing that motivates me most of all is the growth and development of the brain and good quality childcare for our children and peace and safety, peace of mind and safety for our parents, knowing that their children are being well cared for. And then for the providers, making sure that the providers are being paid a living wage, that they're being given education, that they're able to expand their learning. And also because what we know about providers of childcare is that they're doing it out of a sense of love. This is not, we're not talking about social entrepreneurs here who are trying to make a ton of money. We're talking about people who love holding the kids, teaching the kids, being with the kids, and of course, having a business which will help feed their own families. So those pieces together really is a reason to have this childcare. And certainly, I'm probably jumping the gun a little bit, but what we learned from the Blue Ribbon panel was this is so needed. So I could go on and on, Skye, but I'll let you ask the question.
No, that's perfect. Actually, what I wanted to do, and thank you for that. It's clear how meaningful it is. It's clear how meaningful it is to you, and that you've really been talking with families and with childcare providers throughout. But I was hoping to shift to this current legislative session because this is such comprehensive. It's a true systems kind of building bill, and I wonder if you can speak to what it took in this legislative session and looking to the past to really, pass such comprehensive change with this kind of vision.
Well, I think it's really important that this didn't come out of nowhere. Okay, we need to make sure that it just didn't arrive fully formed in the legislative session this year. This is years of work by providers and advocates, and the work of the Blue Ribbon Panel and the work of social impact partners. So the Blue Ribbon Panel brought together businesses, nonprofits, government. It brought everybody together to the table, and it was built off of what we learned during COVID, when $300 million of federal funding went in to make sure that we could keep our childcare centers open. We learned so many things from that period. And then the Blue Ribbon Panel did the research, met with everyone, got more information. And then the advocates continued to push. They continued to push, the providers pushed, and then the legislation really took place over many, many, many months of conversations, of which I was not always a part. I want to be really clear, was education, our education committee, and the Office of Early Childhood and the governor's office and other providers, you know, having voices and advocates having voices. So it really brought, by the end, everyone together to this. And there were 3 different types of legislation out there addressing childcare, significant legislation. And by the end, we'd sort of brought them all together, primarily in SB1, but also in 5003, which includes a portal for registration and figuring out whether or not you can, what you're eligible for, and ways of finding positions that are open. Doesn't exist yet, but that's the plan.
Yeah. I thank you for pointing out some of those. I was thinking there was a House bill, there was a Senate bill, actually more than one. There were
I
many
think there were
bills,
2 House bills
right?
and 1 Senate bill, I
Right.
think. Yeah.
Yeah. And the governor's proposal. So
Yes.
crafting that
It's off. Yeah.
all together was really, the work of this legislative session. And I know with Alex and Eva here, we'll have some of their perspectives, later as advocates and providers. But thank you for, tying those pieces together for us from the beginning.
I
Oh,
did want to just mention something I forgot to mention, which is another motivation of working on this was the fact that so many times I heard from parents and providers and grandparents about the need. And it was a constant refrain from door knocking, from conversations, from emails, from being up at the legislature. The need was so great for really fixing this problem.
thank you. So that is going to be such a good setup for talking about what individuals can also do. I actually want to put a quick pin in that. I'd like to come back to it, but I hoped we could ask you, well, why don't we go there? I hoped I could ask you, what are ways that individuals who want to be involved can think about using their voices? You just pointed out talking with their legislators. What are some other things that come to mind?
Well, the legislation's passed now, so that's really exciting. But we do need continued advocacy. We absolutely are going to need continued advocacy, also engagement with the Office of Early Childhood and monitoring the process to see where we're going. We've got a lot of great plans, but it's going to take a tremendous amount of work. And I know that Beth Bai and OEC are very dedicated and committed to this,
Mhm.
but it is going to take oversight and just keeping our eyes on it to make sure that things are moving along. And the other place that people can use their voice is the funding. So there is pushback now from the other side of the aisle, who are not that excited about the moving the unallocated surplus before the end of the fiscal year. And so I was at a meeting last night where I was hearing that. And I know we need to keep laser focused on making sure that that commitment to funding the endowment continues. We can't presume it's going to, because as you know, budgets are always tight. And there was at one point, we knew that there were about $300 million worth of unallocated interest. And if I heard I heard at least 30 ways that money was going to be used. right? So we just know we need to focus and make sure that every year this endowment does get funded.
Thank you. I think that is such an important point. There are going to be a lot of needs. I know you're coming back for a special session. There's a lot happening at
Let me know if you hear when. Okay.
uh, and so I think those points are so well heard. One last question is, what do you think is really kind of critical that when we talk about monitoring and messaging in the stories, like that what legislators really need to hear about this? What are some of the things that you think are important to be learning about and then communicating back to legislators to make this case?
Well, because we will be moving the 200 million in, and we will take a percentage of that and support administrative costs at OEC. But the work that they're going to be doing is what we're going to need to have check-ins on. So I'm the co-chair of the Children's Committee. OEC is under our cognizance. So those kind of check-ins are what I will want to be hearing. And as providers start to get support through the funding, the administrative, the education, all of these things, we need to hear back from them how it's working, or if it's not working.
Mm-hmm. And shape that. Thank you. Those are all such salient points that need to be heard, and we're a big focus for today. So I really appreciate that. I know we're right at your time.
Oh my gosh.
Yes, thank you.
Good.
We could hear a lot more, but I know you said you might be able to stay for a few more minutes, but there's another commitment. But I just want to say thank you so much to have the experience and the background that you bring, your social work experience, your nonprofit experience, kind of crafting this policy. I think it's so wonderful for the families and children of Connecticut. So we really appreciate all that you're doing.
Well, thank you. I do have to say that one of the values that I know the Social Impact Partners shares is making sure that things work and making sure they work well. And so knowing that SIP was part of the process has been great for me, because I was a partner back before I started being a senator. So thank you all for the work you all do. Really appreciate it.
Thank you. That means a lot. That means a lot. Appreciate that.
Thanks, Skye.
We will now get to hear the perspectives from the advocates, our advocates, and actually they wear many hats on this call. So Allyx Schiavone and Eva Bermúdez Zimmerman, we're going to be moving to the conversation with you. And Allyx, for those who don't know Allyx, I don't know how you don't, but it's possible that you might. Allyx is a co-chair of childcare for Connecticut, so is an advocate, is the executive director of a nonprofit and multi-site childcare centers, multiple childcare centers in Friends Center for Children in New Haven. And she is also the author of some innovations that get a lot of attention around the country for ways to really sustain and strengthen the educator workforce and really high quality care. So we won't get into all of that today, but it's important to know all of these hats that Allyx brings to the table. And then is Eva, just looking to Caroline, if Eva can join on the spotlight. If not, we'll just start with Allyx. I just want to make sure.
We just need her to start her video so we can spotlight her, and then we are all set.
Great. Eva, so if you could start your video, we can do that. But while you're doing that, we can start with, we had the same question, Allyx, for you and for Eva.
Great.
Which are about your perspective and what it really took for this historic legislation to pass.
Thanks, Skye, and thanks for having me here. When you asked that question, the first response I had was, aside from the hundreds of years of women subsidizing our economy, you mean, right? aside from all that work, like Senator said, that came before it. And I think of it as a lot of factors came into it. One, I think we had some landscape slow boils, as I call them. So things that were happening over a lot of time. One is that we've learned more about brain science as a society. And so we were focusing more on early care and education and recognizing that the 0 to 5 age range has a tremendous impact. Two was that we have economic pressures now where households must have 2 working parents, or if they're single parent households, they're working multiple jobs. So they need childcare. And 3 was that Connecticut really was at the forefront. So the Office of Early Childhood had been established a long time ago. We have a strong system in place. So those are sort of what I call slow boil things. And then we had the shock to the system, which was COVID. And so when COVID came, it really just was like this jolting and horrific moment for those of us in this field. And that's when the forming of Childcare for Connecticut started. And so it was in reaction to that shock. And then we have founders like Eva, obviously who's on this call, and Liz Frazier and Meryl Gay and Izzy Greenberg, right, who started this. And then we sort of I'm just sort of giving you the pathway. Then SIP came into the picture and really created this backbone. And so we had these advocates and this passion and this desire, and we were in it, though. We were in the melee, and SIP came in to really offer that backbone. And then we had people who stepped up into leadership, right? And so Friend Center became the chair of the ACT committee, which is Action, Community, and Tenacity. It's a offshoot of Childcare for Connecticut. You've got people like Ava and Meryl and all, people who leaned in, and it became about consistency at that point. So our messaging is fix childcare, invest, transform, expand, fix childcare. I mean, I'm going to be that crazy lady who is saying that till I'm 100, right? I mean, that's sort of who I am. And you had a lot of people doing that. And so we started Morning Without Childcare. We built relationships. We started the advocacy. And then because of all that hard work, we got funding. We cannot overlook the fact that this really became a effective tool once we got funding and could become a formalized organization with formalized staff, momentum. And then we started looking at data. How do we shift the minds of decision makers and voters and the system? And that really became about awareness and action. And then this is all coupled with, so you have all those things coming together, coupled with decision makers. You had willingness. You heard about Senator Maher. You have Senator Looney. You had Governor Lamont. And these are based on years of relationships, as she mentioned. So that to me is really how we got to this place, right? It's all those factors put together.
Thank you. That's so important, I think, to take that look back, because it doesn't all come together in one legislative session.
No.
And Eva, I want to welcome you. For those who don't know Eva's the Coalition Director of Childcare for Connecticut, and as also an advocate and over a decade of experience in advocating for childcare and at SEIU, even before taking this role, the startup role as a coalition director. So Eva, so glad that you can join us today, and want to ask your perspective on this. What did it really take for this historic legislation to come to pass?
Thank you for having me. So what it took I would say that if you're a new person coming into the space or paying attention to the early care and childhood space, then it took a year, right? We passed legislation in a year. But if you're someone who's been in the space for a while, the reality, and echoing what our awesome chair mentioned, it was behind the scenes, decades in the making, right? So decades of having conversations to create the Office of Early Childhood, time to really see what the Office of Early Childhood and what they could implement look like. So that was, an additional decade there in creating the Child Care Union that then lifted up the salaries of thousands and thousands of workers within the industry of childcare. And then from there, also adding on new programs and legislative proposals like the creation and consolidation of Early Start, Smart Start. So technically, at least 3 decades to get here, and then the stars aligning. But using the most unfortunate time in American history, or one of the most unfortunate times of the pandemic, and using that tragedy as a catalyst to really come together and have some cohesion. When we were in the pandemic, and just giving a little bit of the backdrop of where OEC was, where advocates were, there are always advocates within the parent-facing groups and provider-facing groups who were trying to change early care and doing different projects with the Office of Early Childhood. But at that time, in the beginnings of the pandemic, there wasn't really a focus of collaboration and unity. It was siloed. Everyone was doing something and trying to really honor the mission of fixing childcare, but there wasn't a cohesive plan. There wasn't a real true mission or vision. And then what the pandemic did, after, you know, those 20 decades in the making of creating the Office of Early Childhood, getting salaries being noticed by legislators, the pandemic spotlight was one that legislators kind of paid attention and said, wow, we really need the workforce to be strong, to be vital, to be accessible. And then that allowed for the conversation of all those partners who typically would do things siloed, who would do one-off projects, to say, we need to do something together and create some unity. So from that unity and that moment, the coalition was created. And then really focusing not just on provider voices in the workforce that supported childcare, but also incorporating business associations like CVIA, incorporating parent or organizing groups like Strive Networks, and then taking all of those pieces to create something strong and create a mission that made sense, and then supporting the Blue Room panel. So when the Blue Room panel was thrusted, it was behind the scenes a collaborative effort from advocates saying we need something. And then the reaction from the governor and from the Office of Early Childhood was to create this Blue Room panel. And that research allowed us the ability to figure out what was really the gap, figure out what the parents were saying, what the providers are saying. And oftentimes before the Blue Room panel existed, before there was a real spotlight in this crisis, those missing pieces of the puzzle didn't really come together on how we could fix it. But with the Blue Room panel, it created a vision of what we needed to fix, right? First, it was identifying what's the crisis and having parents talk to providers. There was this understanding from the parents that I pay too much, and understanding from providers that they don't have benefits and the workforce isn't really being supported by salaries. But these communities didn't really often talk to each other. They didn't quite know that how the hardships looked like on either side. And by creating a space where they were connecting and understanding each other, it allowed for some great ideas to come out of it. And there, the Blue Room panel was capturing that data, that information, those stories, and really listening. I know that organizing is not an easy thing, but taking into consideration what people actually have to say makes the world of a difference. I'll pause there. I think I said too much.
Actually, that was perfect, and thank you, because we started to get into that next question that I wanted to ask you. You both, I think, took some different looks back on what it really took to get into some alignment, and there was this recognition. I remember among advocates about how challenging it is to move a few things forward at a time, and just the education that was really needed about the bigger systems challenges, because it felt like groups were being, from the language that has been using, like groups would be sort of the families could be pitted against the educators, and that was never really going to move things forward. So Eva, you already jumped into this really well. Just ask for another brief moment on this. But I want to note that you took on this role in mid-2023 as the first hire and coalition director of a startup advocacy organization. And immediately, it was about halfway through the work of the Blue Ribbon panel. So you kind of came right in and immediately had to jump in and try to have more voices at the table. I think you did that right away. And looking back through this lens of this legislation, can you talk about in this legislation why it was important to have that panel and that community input and that, report ultimately?
Oh, absolutely. So when going back to that history of like our foundation of why we needed to create a movement, right? I will start with our first official meeting when we were at a hearing. We had pretty good turnout for our early childhood space. We had about 40 people signed up to testify, and this is now 4 years ago. And in that testimony, I don't exactly remember who the individual was who was testifying live, but we had messaging that we agreed to as a coalition. And we were asking for $700 million to fill in the gap and have crisis money, even though we all as advocates agreed that we would need at least $1 billion plus to fix the system. But we didn't have a cost model. We didn't have a study ready at that time that really said, this is what childcare transformation will cost in the state of Connecticut. So in that hearing, when we asked for $700 million, literally live, and we have the recording on YouTube, there were 3 legislators in the committee who laughed. Like they were unmuted and on camera, their camera was spotlit, and they were laughing, and you could see their faces. And all of the advocates were super serious, parents, providers, all wondering, like, why do you think this is? And we asked them in live time during the question portion, and they said, well, that number is just too ridiculous that you're asking for $700 million. We usually give you 50 million or 100, and at most maybe 200 for raises for care for kids. And we had to explain to them and try to plead our case in that hearing that wasn't even the full amount that we needed to fix childcare. But a hearing wasn't sufficient to make that case real, to really let it permeate in the minds of legislators and elected officials. It wasn't until the Blue Ribbon panel, where there are convenings with national experts, where we had advocates who had been in the space for years and really distinguished researchers, that the legislators and elected officials started listening and started paying attention. Oh, their 700 million is low. It's a low ask. And it's actually a real number. And in order to fix this problem, it's a lot more nuanced and complicated than what we could have ever imagined. And, everything that advocates like the Meryl Gays or the Marks of the world were saying about cost and how much we have to dedicate, and like Liz talking about access to parents, these were repeating themes that were highlighted in the Blue Ribbon panel. And that takeaway, and like, I guess going back to your question of like why it was so important, it wasn't just an opportunity for elected officials to take us seriously. It was an opportunity for us to lay a pathway of how we were going to fix it. We were so bifurcated in our vision of how and what we were going to do, and just knew that we were tethered together by the desperation of need, that it wasn't until this plan where we came together, we put our bygones aside of, well, childcare needs to be fixed because parenting affordability, that we know, or childcare needs to be fixed because providers need to get paid more, that we know. It wasn't an us versus them, a parent versus provider. It wasn't, advocates want this or are trying to make this reality happen without insight. It was all of us saying the same language in collaboration with the Office of Early Childhood, with the ears of some of the most respected leaders in our state, with the governor's blessing to make this happen. And then the end result was the 5-year plan that was going to cost a lot more money than anyone anticipated. what better way to gain the respect of elected officials than the end result not being framed as a minimal step forward to fix it? It was truly a transformational vision. And then the additional point that I would make of like what was important about the Blue Ribbon Panel and bringing the advocates together was that during the hard times in this last legislative session, 2 years after the Blue Ribbon Panel convened or started convening, when we were as advocates confused or concerned about which trajectory we were going to go, and internally we had those moments where we were unsure and maybe we're going to make significant concessions because the desperation of wanting something to happen, our guiding light was the Blue Ribbon Panel plan and reminding us, no, we have a path forward. We have a plan. Let's stick to it. We don't have to reinvent the wheel because we did the research, we did the hard work. And now if we stay the course, we could see the success. We can see this victory. So long-winded explanation of it. It was for Connecticut, I don't know about other states, it was a necessary next step to get to where we are now.
Thank you. I think that, you really provided the whole picture, right? Without a plan that people felt that they could have buy-in and really have an understanding of whether it was agreed upon 100%. And we know that no, all plans like this, there's some compromise and it's challenging just to get to them, but the very big picture could remain in the forefront. So thank you for sharing all of that perspective and then how it was beneficial in this legislative session when it really became critical to have that alignment amongst advocates. So I really appreciate that perspective. I am going to move us to, and Allyx, I'd love to come back to you, what you are seeing for what is needed to capitalize on this moment. We asked the same thing from Senator Maher. We know that this is, I think I've heard you use this, Allyx.
Yeah, don't give away my, don't give away
don't give away. Okay. I know you've thought about this a lot.
Yes.
So please tell us what you're thinking is really going to be critical looking ahead.
Yeah, so the most critical next step on this like macro level is to make sure that decision makers and voters and people who are not in the system know that childcare is not fixed. It's improved, but it's not fixed yet. The analogy I use, which Skye hinted to, is that we just completed the first 2 legs of a marathon, and we need to dig deep and stay the course for this last leg. We had a whole debate about what the last leg is. I think it's the running portion, which is my least favorite. And so we cannot rest on our laurels. Right now, we're in first place. Literally, we are first in the nation to create a child care endowment that focuses on access, quality, and affordability. Access means more slots. Higher teacher pay. Higher teacher pay means higher quality, and then lower fees means affordability for families. So we're in first place right now. If we don't continue, though, we will not be able to hold that momentum. And so we need to hold legislators accountable. You heard sort of the senator mentioning that as well. We need to keep our coalition together and actually build on it. It has to get better. And we have to remain steadfast in our advocacy. And that first thing I mentioned, making sure that people recognize that childcare is not fixed, I think is our biggest obstacle right now.
Mm-hmm. Thank you. I really always appreciate how you think about these things. And as someone who's forward facing and the chair of this coalition, you're always breaking it down, I think, in terms that really are very clear and can help others, lead others, to what is next. Eva, is there anything that you would add to that? Especially a few kind of key areas where you think the focus should be related to implementation and policy and crafting policy that really, this policy was crafted, but in meeting the intention of all of that.
Going back to, the history of how we got here, I didn't mention earlier that on the very long list of steps that were needed to be taken, it was the creation of the parent cabinet. And I mentioned that because in the next steps, we were able, we as the advocates, whenever I say we, it's like advocates, people trying to support the system, we were able to create a lot more engagement, parent-facing engagement that just didn't exist right now. It existed in the past. A lot of the nonprofits that operate in the state of Connecticut have parent groups, and some particular nonprofits might be looking for housing solutions or accessibility to job and workforce development. And then within those organizations, then they have early care or child care committees. But the idea of having a nonprofit that's just parent-centered, specific to only care and early education, doesn't really exist anymore. You know, before we had parent power, and now as an organization, as a coalition, we found it very difficult to engage in the conversation of just parent-centered early care work. And we really leaned on parent cabinet members that were previously serving on OAC and leaning on the Strive networks that exist and the committees that exist to carry that message forward. So on the next steps, we have to make sure as a coalition that all of that hard work and activating parents and how we activated parents, the training mechanisms, the onboarding, it doesn't just dissolve, that work continues on. Yes, your child might get older and you kind of age out of the organizing and advocacy just because, you know, your children's no longer an infant or under 12 years old. But it doesn't mean that these different nonprofits who are partners in our organization have to walk away from this conversation, because without parent input, without the work that happened right now in going into implementation, then, you know, the end result will only be stronger if you have that parent input. Of course, and shout out to the providers out there, the early educators out there, they're part of this conversation and they need to be part of the input as well. But those organizations that represent child providers, home-based group homes and centers already really have a strong network and strong lobbying groups that are innate to their organizations. In the implementation, my last, I guess, feedback on next steps, we have to be very vigilant of what the federal impact is going to do here in Connecticut. So part of the next steps is having real conversations of how we fortify this legislation. How do we make sure that in implementation, we're not dissolving or undoing all the hard work that we've done so far? And that means really having some hard conversations with legislators and internally of how do we pivot, how do we prepare for a future where the defined revenue source is as strong as it needs to be and expanding beyond what we built. You know, expansion, this project right now, this legislative proposal that was passed is not the end. This was the beginning of transformation of childcare. But we would love to see a reality where parents also have affordability for after school programs, before school programs, summer camps, and it's all interconnected, right? The providers, a lot of the providers who provide after school, before school, and summer camps are also the providers that provide infant toddler care. So we have to go back to that table of education to make it happen.
It is. It's all connected.
Guy, can I say one thing?
Yes.
So I misspoke and said marathon, because I'm not a marathon runner, but it's actually a triathlon. That's what I meant to say. So this shows you how
that's okay. That it's long. It's a long race.
Yes, hold on to the triathlon, not the marathon.
Yeah. Okay. This has been such a good conversation. I always appreciate how each of you are thinking ahead and your leadership. And we did hope to hear from you a bit on our partnership with Social Impact Partners. We don't have a lot of time for that today.
You can do it.
Okay, Allyx.
I can be very clear.
Okay.
So the way I see it, SIP was the community quarterback before we had adequate funding, staffing, and infrastructure. And I really think that we would not have succeeded without your backbone support. They were both, because you offered both strategic and operational support at a time before we were who we are now. So I want to be really clear on that.
Thank you.
Do you want me to
That's
do my
meaningful.
1 minute one?
I don't think we have I don't think we have a lot of time for that. I do want to give time for Q&A, but I think Allyx, our partnership, and Eva, our partnership, it's been long-term, really meaningful. We appreciate the opportunity to support all that you are doing in working in your advocacy and parent advocacy, and really creating these voices that need to be heard in order to lead to the next, steps and to realize this vision of this legislation. So thank you. Because I did promise that we were going to get to time for Q&A, and folks probably have questions for you. So we'll just take a minute now. I forget if I said that, but so appreciate your leadership and time here today. And we will take a minute and turn to Social Impact Partners Executive Director Mark Argash to talk about some things that we're seeing that are coming next. And Mark, I'll turn it over to you.
Thank you, Skye. First of all, I want to thank everybody on this call for their leadership. Allyx, Eva, Senator Maher, Commissioner Bai's not here, but we will feature her at a upcoming kind of lunch and learn. And of course, Skye and the SIP team and other providers are on here. Thank you. I just want to say a few points about kind of the path forward. The real test for us will lie in implementation. I love Alex's point about triathlon. I break it into a few different areas. One is kind of infrastructure, systems building, and sustained advocacy. The Early Childhood Education Endowment Fund is the financial vehicle to implement this strategy. It's going to need work in terms of getting it up and off the ground. The Office of Early Childhood is really charged with leading the kind of implementation in terms of programs, policies, building out systems like the family portal. And they're going to need to continue to get support both internally, but from those of us as well, including SIP, in terms of providing the Office of Early Childhood the support they're going to need. And as has been said before, this funding is not guaranteed. We need sustained advocacy. Organizations like Child Care for Connecticut, the Alliance, they need our support. SIP is proud to support them, and we need to continue to build, as Eva was saying, additional grassroots support to keep public and policymakers focused on this. A second big area is empowering and expanding providers. Connecticut is home to 4,000 early childhood providers. The vast majority, as Senator Maher said, are small businesses. They are generally they've been under-resourced for decades. They're going to need technical and financial support to be able to grow their capacity. They're going to need to recruit and retain educators. They're going to need investment in their facilities and quality in order for us to create 20,000 new early childhood slots over the coming years. And third pillar, I would say, is workforce development is really critical. None of this is possible without a strong, stable, and respected early childhood workforce. And this means partnering with colleges and high schools to build out programming and career pipelines. It means expanding apprenticeship opportunities in collaboration with childcare programs, and especially offering robust professional development and financial support for our existing staff, our existing educators. Workforce development is a moral imperative and economic necessity to build a high quality system. I'm really proud of the importance that has in the legislation that we passed. Final note in closing, we need philanthropic support. This work that needs to happen, is going to require significant help to continue to build the infrastructure and systems to sustain the advocacy efforts and to support providers as they scale up to be able to meet this need going forward. So we would not be where we are without kind of a lot of kind of broad kind of financial support, and that need continues even more so as we move into implementation. So with that, I want to turn it back to Skye so we can get some Q&A.
Great. Thank you, Mark. The work that you outlined, I think the fact that you could do that in the 5 minutes, it's truly comprehensive. And as we've heard from all of our panelists today, it's going to take the true implementation. I think we've heard from our board too, underlining that implementation from Senator Maher, hearing from parents and from providers about the impact is going to be so important in the coming years. And so I do have another question in my back pocket for Allyx that we didn't get to, but we did get a question here that I will turn to. But thank you, Mark, for laying that out and for starting to connect the dots to the opportunities. I know we've had a lot of enthusiasm from social impact partners, volunteer partners, as far as working directly with organizations, with providers of early childhood, early education, and helping to think about and address in this changing environment, in a challenging environment, how do you plan to grow? I know, Allyx, I really appreciate your partnership and all of that, and we're truly hoping to grow that over the coming years as a key initiative. We have a question in the chat that I will turn to, and from Gregory Melville. Regarding the next phase of our work, where might we look for models of how to continue to build out the coalition and continue educating members of the legislature, parents, and the public? So I can put that, we'll do that as the first question, then we have a second question, but I can put that to any of our panelists, especially our advocates, but I know, Mark, you've looked at this too. So what are other models, whether they're in early childhood in other states or other models of coalition and advocacy and organizing that we can look to inspire us here in Connecticut?
I guess I'll kick it off really quickly. Child Care for CT did a very extensive research project with the help of the social impact partners, doing a deep dive on different models. And one thing that we found out is that there's no perfect model that you can replicate in a state, but some models that we really loved, I'll use Louisiana Go Far, and it's not spelled G-O, it's G-U-E-G-U-E-X, Go Far, because of Louisiana and the French. And I loved their parent organizing and provider mobilization model. So it was really community-led, having groups throughout their state that led the conversations, created internal leadership structures, and then those leaders would then go out and disseminate the information. It was a lot more individually led, smaller groups. Another good example is Virginia. Virginia was a cohort of different nonprofits using smaller stipends, where their main funder said, hey, the coalition there would use that money from their main funder, then distribute the funding to existing nonprofits that already had mobilization and infrastructure embedded into their nonprofits, and then they would do the early care work. So those are just two good examples.
Yeah, those are really interesting ones, and it was so clear that you need to build on the assets and the communities and the assets and where the energy is in the state, but a lot of inspiration. Allyx or Mark, anything that you would want to add to Gregory's question? No? Okay.
One other thing I might just add, because there was a question embedded in Greg's question about the OEC or other kind of governmental organizations. I think it's important to point out that the intent of the Office of Early Childhood is to start this process by doing community planning over the next year. So in other words, there will be efforts throughout the state to engage stakeholders in every community around the state and to make sure that the priorities for spending really reflect community needs. And one thing we learned in the blue ribbon panel process is one size does not fit all in terms of looking around and the challenges that different urban, rural, suburban areas of the state kind of face.
Yeah. Mark, I'm glad you brought that up, because in preparing for this, one of the points we discussed was just how important it is to have that stakeholder input to have policy that really meets the need, and that was an important piece of the blue ribbon panel work. There is also another question, as you said, embedded in here about educating members of the legislature. And I don't know if there's anything else that we want to tease out there as we wrap up, or and if not, because Eva, you gave some great examples, I might just ask if there's any final comments, anything that I didn't ask or you didn't get to. There wasn't another opportunity to speak to today. This is a great time for it as we wrap up our last few moments.
I think there's two things that I wanted to say that I didn't have an opportunity to, and one is too long to get into now, but really making sure that everyone recognizes and understands the way that the market works. Like our system, we work in this free market system, but childcare can't do that. And so there's all these nuances in there, and I think understanding that business model is really critical for anyone who's involved and or supporting this advocacy work. That's one thing I'm happy to share some thoughts on that at another time. And then the second thing is I really just wanted to highlight and acknowledge Eva's leadership and her work as the director of the coalition. It's an exceptionally difficult job, and she has done it with grace and passion, and the results speak for themselves.
I also want to highlight something that, thank you, Alex, for saying that. Could not agree more about kind of Eva's leadership. I also wanted to just highlight some comment by Kim Russo in the chat. We wouldn't be where we are without the Early Childhood Funders Collaborative. The OEC would not exist. They've been supporters every step of the way. They were key supporters in getting childcare for Connecticut off the ground. So thank you to ECFC, which is a key way that philanthropy comes together in support of early childhood education in Connecticut. We are, SIP are proud members of ECFC, by the way.
Thank you, Mark. And I'm going to jump off of that for final remark. But Eva, you have your hand raised, so let's go back to you.
Well, I guess it was my final remark. The what to add here is I wish I could say that this path was easy and that we all got along from the very beginning, but that's not realistic. You know, the reality is that this work was very, very hard, and it took a lot of collaboration to get here, as Alex, Mark, and folks and Ceci, Senator Maher mentioned. But the foundation was one of true grassroots organizing, something that I learned many years ago, 19 years ago when I started organizing, that to be a great organizer, you have to be really capable of active listening. And something that as a coalition we really did, and that the OEC did, was active listening, taking that feedback and the comments and the struggles that providers and parents are going through and making it into legislation, not just piecemeal, actually taking the collaboration and doing something that was a cohesive plan, I think is a true victory of this legislative proposal. And of course, we couldn't have done it, as Alex, our chair, said, without social impact partners. This coalition was created from scratch, from nothing. It started as volunteers coming together and sacrificing their own time. And it was amazing to see how our partners, through social impact partners, evolved with us through each iteration, from the staff support to then strategic planning, to then rehashing and revamping our governance, to then transitioning into policy and the patience it takes to get there. So just echoing the love to all of you, and how we took the impossible and made it into reality, and really took that active listening and that compassion to bring it into success.
I also, one more acknowledgement, Skye, sorry. I want to acknowledge our partners at the Connecticut Project. They've been partners with us every step of the way, from the Blue Ribbon to Commission to supporting childcare for Connecticut in a very expansive way. And it's great to have, as Eva said, this doesn't happen without a huge amount of kind of partnership across the state. I loved at the governor's press conference last week when Eva brought up the head of the State Business Association and the head of the SEIU labor union on either side of her, put her arms around them and said, this is the meaning of a true partnership. And that kind of, I think, said everything.
Thank you. Thank you again to each of you. I do have to say, Kim's comment also reminded me there are many perspectives we just don't have time for today. We'd love to have the OEC perspective, so many other advocacy partners. And as Mark mentioned, we are looking to do something that is a bit longer, maybe even in person, and be together this fall so that we can share more of this. But we wanted to be able to come together this June and mark this moment because it is so meaningful for Connecticut children and families and early educators. So thank you all for joining us. We are really so thrilled to see this kind of interest, and we will get you on your way now. Have a good afternoon, everyone.